If you've ever heard of Prozac or Effexor, you're already familiar with SSRIs and SNRIs, two of the most commonly prescribed antidepressants. So, what's the difference between them? SSRIs stand for selective serotonin reuptake inhibitors. They work by increasing levels of serotonin, a feel-good brain chemical that helps regulate mood, sleep, and emotion. Common SSRIs include fluoxetine, Prozac, sertraline, Zoloft, and citalopram, Celexa. SNRIs, or serotonin, norepinephrine, reuptake inhibitors, also boost serotonin, but they add a second chemical, norepinephrine, which affects focus, energy, and alertness. Popular SNRIs include venlafaxine, Effexor, and duloxetine, Cymbalta. So how do you choose? SSRIs are usually the first-line treatment for depression and anxiety because they have fewer side effects. SNRIs may work better for people with low energy, chronic pain, or when SSRIs aren't effective. Side effects of both can include nausea, sleep changes, and sexual dysfunction, but SNRIs may increase blood pressure or cause more withdrawal symptoms if stopped suddenly. In short, both SSRIs and SNRIs help boost mood, but SNRIs target two brain chemicals instead of one. Always talk to your doctor about what's right for your unique brain chemistry. If you found this helpful, hit subscribe for more medical animations.